If you're building in healthcare AI right now, the biggest tailwind in plain sight isn't another model benchmark. It's the wave of CMS value based mandates that went live this January. TEMA alone covers 742 hospitals and 1,800 plus medical groups with up to $85 million in new Medicare revenue per system on the table. Today's guest saw that wave coming back in 2019. Eddie Qureshi is the founder and CEO of Rainfall Health, an AI driven compliance and reimbursement platform that just closed a $15 million Series A led by Two Bear Capital. Rainfall is already integrated with 200 plus of the team mandated hospitals, has facilitated care for more than 100,000 patients, and is building towards the national RAIN compliance standard for mandated care models. Eddie, it's amazing to have you on the show, so thank you for being here today.
Thanks so much for having me, Vic.
Wanted to kind of dive deep into Rainfall specifically. I mean, you kind of started, I did a lot of research as a podcast host. You're considered like this online stalker. Your mom ran a pulmonary critical care clinic in a large kind of town. And correct me if I'm wrong, but your grandmother was one of the first female physicians in Pakistan. Amazing. What was the specific moment, I guess, you decided that rural access, telehealth was super important to you and that this is such a big, crucial problem to tackle?
For me, I've been in healthcare my whole career. I started off as a synthetic biologist, so overlap of AI and biotech, point of care diagnostics, and then early stage drug discovery. But I always wanted to get closer to the patient because it was always about access. And telehealth to me was this first wave that allowed us to actually leverage technology to improve access. And so that's kind of where the journey sort of began with under-resourced areas and has sort of gone through a couple of evolutions without ever changing that initial mission of how do you improve accountability as well as access to care.
Interesting. So when it came to, starting Rainfall specifically, what were the kind of key challenges that you had when you were speaking to a lot of the, prospective customers or prospective, investors or anybody in the pipeline for healthcare that you kind of were like when you were exploring Rainfall, and how does that correlate to what it is now?
Yeah. How many days do we have to go into it? It was a journey of finding what it is that we're selling and who to. I had a great mentor who was an executive at a major health system in the country, and there's two things that he told me that took me several years to understand. It was two sentences and took me several years to fully understand it. The first one was, are you building a product or are you building a feature? A feature is something that embeds into a broader scope, right? So you're relying on so many other things. A product is standalone. It's something that's actually solving a problem by itself. So that was number one. And number two was, and this spoke to the scientist in me, which was there's no law of nature that says that hospital sales cycles have to be 18 or 24 months. And it took me a really long time to fully internalize that because this year we've been able to show repeat sales cycles for 5-year contracts in under 2 weeks. And that's the challenge here was finding out what is the product itself, that full end-to-end solution. Not the technology is a way that we deliver it, but the product is the actual solution and the
Okay.
problem we're tackling. And then finding who are we solving this problem for within the health system? Because these are complex organizations and with so many different stakeholders. So finding that one customer profile that you're truly solving the problem for makes all the difference in the world.
Yeah, and that makes so much sense. And specifically, what kind of got the idea that what you're building is a product and not a feature? I mean, obviously you have multiple features, but how did you kind of think about Rainfall will actually be a product, and this is how we're going to make it a product?
I think, it was kind of an iterative cycle in many ways. For the first few years of the company, we were working on a lot of rural health centers. We were working with indigenous communities, again, in rural areas. But overall, we were serving a population within Medicare. Over 95% of our patients were actually Medicare already. And when the Centers for Medicare and Medicaid Services announced this new switch to the mandatory models back in 2024, we realized this was an avenue to actually help shift healthcare as a whole towards where we were already moving it, sort of one system, one community at a time. This was a way to make sweeping change happen and kind of not not different, too different from how EHRs were rolled out back in the late 2000s. And so when we saw that shift happening, we started building AI native tools around these changes because who doesn't want better quality of care at lower cost? Virtue, we also had some lucky breaks. Everybody took a step back when the general election happened, not knowing where things were headed within Medicare. We actually leaned in more. We invest into this technology, this platform that we were building from the ground up. We built the first and what are still the only operational standards for these mandatory models. And then the new leadership came in place, Dr. Oz, Robert F. Kennedy, Abe Sutton, and everybody for some reason was still hesitant on where this model was headed. We leaned in more. We actually built an operational committee with executives from 10 different health systems across the country, including Kaiser, Mayo, Sanford, UPMC, to build not just a product, but also a product that was built by and for health systems. And when the model finally went into effect, now this is 2 years of build, January 1st this year, 2020, everything changed because now the model was mandated, it was live, and we overnight became the de facto standard for the first wave of these mandatory models, starting with TEAM, which is Transforming Episode Accountability Model for post-surgical care.
You mentioned CMS and working, kind of leading into their specific models. One of the biggest kind of models that you work with currently is the team. Do you mind kind of talking about what the team model stands for, what that is specifically under the CMS, and how you guys are kind of working with healthcare organizations to kind of improve revenue and things like that?
Absolutely. It's a value-based care bundle payment model through Medicare. There's a couple of differences. It is a mandatory model, so they actually call out 741 hospital systems by name, and it applies just to 5 surgical procedures: lower extremity joint replacement, surgical hip and femur fracture treatment, cervical spinal fusion, major bowel procedure, and coronary artery bypass graft, CABG. So just these 5 procedures and managing a 30-day episode post-surgery. So once you have your surgery happen, managing every aspect of care. If you got a joint replaced and you also happen to need, mental health services or even a colonoscopy, completely unrelated, there's only one entity that's responsible for all that care, which is the hospital at the end of the day. And that's what's so powerful about these models, because ultimately it breaks it down into 4 pillars, which is how do you derive reimbursement from improving quality, improving patient satisfaction, improving clinical outcomes, and lowering cost. Those are the 4 pillars that essentially team requires these 741 hospitals to be fully responsible for just 30 days to start. And it's actually been set up as an experiment, which is already working and showing great results because there's expansions coming out starting next year. The best thing about Team, however, is there is an additional 20% incentives for the hospitals that adhere to those 4 pillars. And Rainfall Health actually built those automated compliance standards that apply across these systems. So they don't have to figure it out from the ground up. We're sort of the easy button, the TurboTax, if you will, so you don't have to go and read all the tax code yourself.
What happens if a hospital or health system doesn't follow the team model? Like, I'm assuming before rainfall, it was a big problem for these hospitals to even follow the team model and actually be compliant as much as possible. How much revenue? What are they leaving on the table, pretty much?
So the reason why these facilities were selected was because about 20% of their annual Medicare revenue comes from just these 5 procedures. So they're going to take a financial impact proportionally, whether it's a standalone rural facility in my hometown of Batesville, Arkansas, or Mass General Brigham, one of the largest health systems in the country, right? Like the proportional impact is about the same. That's why they were selected. And if they don't adhere to these adjusted standards, there's also not just that additional 20% incentive, there's also a penalty, a 20% penalty that comes in to these systems. And even the largest health systems absorbing up to, almost $100 million is a lot. So, but I spend all my time, and actually our business model too is going fully at risk, doing a revenue share with all of our partners. So we're the only ones that do full partnership end to end, again, product and how we deliver those outcomes, and then bring that additional new revenue dollars for existing services that the hospital is already providing. That is why we have such fast sales cycles. That's why we have so many systems leaning in because they're already mandated to participate. We become the easy button and we're willing to put our money where our mouth is too.
Kind of taking back into the beginning when you first got that first pilot or, first customer, what was the story of like getting them? I mean, it's notorious in healthcare. It's very difficult to find out those key champions that can get you to that first pilot. I mean, a lot of founders have that problem. How did you navigate getting that first customer and to obviously where you guys are at now?
Yeah, I think that's a great point. I will point out that we're actually notorious. We get this question a lot. Do you do pilots? We actually do no pilots
Mm,
ever. And the reason is we are already fully at risk, right? So we actually go in at risk already for 5 years and we deliver care from the ground up. And if somebody just meets the minimum standards of our framework that we built, they just break even and we don't make any money. My job is to help actually improve care so significantly. And we built our own framework around it. And that way the patient benefits, the health system benefits, and only then we benefit, right? So that's one aspect. But how we landed our first customer it was very simple. We were trying to find out who ultimately can make that call internally. And for us, it's the CFOs and the CEOs of these systems. Notoriously difficult to get in touch with. However, my claim, claim here is I just need 20 minutes with a health system CFO or CEO to get them $20 million a year. Like that's what I do. Right. And that's a good ROI that I can point to tangibly using their own numbers and also tell them that I'm going to help them deliver. Right. So when systems see that it's not just a software solution that they can buy and put on a shelf, a software solution where the customer service doesn't need to stay with it, a solution that doesn't integrate with their existing systems, that's where those issues come in. That's why it takes 18, 24 months for most places to sell into these systems.
mm,
We come in at risk, showing them real dollars and cents, opportunity in the short term while building to the long term. And that's what changes that dynamic in that conversation. And to be clear, we spent 2.5 years leaning in when everybody took steps back. And that high conviction actually helps us get pretty far. And then the fact that we have the buy-in from some of the largest health system executives in the country, putting their credibility, their reputations on the line to show that we're worth that investment by the systems.
for sure. I mean, kind of is it now when it comes to distribution process, is it now mostly through network and that trust basis, or is it still where you have to grind and get those, customers based on, promise or, based on, people that they may not know who's using the product? What is the common distribution angles that you've been seeing now?
Yeah. So, our initial joke to our investors was if we don't do this, if we don't put together a standard, we call it the RAIN compliance standard, then of the 741 hospitals that have to participate in team, there's going
Hmm.
to be 741 different solutions that they come up with. Right. And that's why healthcare just gets more fractured instead of
Right.
more cohesive. So for us, it was really about bringing those components together and making it incredibly tangible to move this process along as quickly as possible.
Interesting. Interesting. So kind of going into like more of the team specifically, how does it kind of work on the revenue standard if like, if a for example, a organization is, using rainfall and now they're overly compliant and they're kind of, not just saving, now they're making additional revenue wherever possible based on the procedures that you listed. How does it work when, for example, a patient does come in and they have cabbage, for example, and that starts. How does rainfall come in specifically into the provider workflow?
Yeah, absolutely. So we act as kind of like staff augmentation as
Mm,
well as AI augmentation of the coordination and real-time episode management. We call it the 3 C's internally. What we do, right? We're a solution, but really what we provide is the first C is compliance. So that's that piece that we touched upon, which is the first and only operational framework that's backed by health systems. The second one is this case management care coordination component where we do it in lockstep with our customers at the system level, and we provide staff augmentation. We provide AI enabled, care flows as well, and we'll work on those to make them compliant as well. And our third C is AI enabled care design. So that means that for every single patient that's actually going through the process, based on their post surgical assessment, based on where they're based in the geographic area, their journey will look a little bit different. And
Mm.
we make that both technologically, but also with the human in the loop so that nobody slips through the cracks. So it's just an extension of the system in many ways. And that's also how we're incentivized from our business model. So we become a true partner to do everything that's right by the patient, which is ultimately the point of these models. And that's how we also, are paid at the end of the day.
I saw that Rainfall also works on the patient engagement front. I don't know, do you mind explaining, like, how you guys work specifically with patients, if that's something that you guys work with? And is that something that, the patients are seeing significant ROI in as well?
Yeah, absolutely. So patients are, we talk about patient centric healthcare
Mhm.
for the last, let's say, half a century. Patient centric healthcare has been talked about. With these mandatory models, starting with a team, it's the first time it could actually become a reality. And the reason is your everybody in the health system, in the healthcare journey, right? Whether it's the providers who are actually doing the surgeries and providing the care, whether it's the system, which is ultimately responsible for the care, and the other, post acute care partners, skilled nursing facilities, home health agencies, remote patient monitoring that'll touch the patient. Everybody is incentivized now by one thing, which is quality, patient satisfaction, outcomes, and cost management around the patient. So following that episode becomes super important. And so we do that in lockstep with the system itself, as well as a whole host of compliant partners. So our RAIN compliant mark isn't just for the system, it's actually for their entire care network
I see.
because over 60% of the actual care in the post surgical space gets delivered not by the hospital itself, but the post acute and subacute care partner. So everybody speaking the same language and holding themselves to the same standards is where you start seeing patient engagement then translate into real outcomes, which ultimately returns on investment.
Right. And When back in, when you started Rainfall in, like, 2019, 2020, obviously Team was not on the roadmap, it's relatively new, I guess. What did you see, and we kinda touched on this, what did you kinda see in 2019 that most people didn't really see in 2024? And I guess a follow-up would be, like, what were the rejections that you got from prospective customers saying, "Oh, this is not gonna work in 2019," that actually kept you still going?
Yeah, I think the biggest piece was what were we solving for at the heart of it, right? Like, again, I had a different mentor who once told me that your mission of a company, of a startup, should be so large in some ways that you can never truly solve it. So, access and accountability have always been our sort of guiding light. Whether it started off with telehealth, and we had so many people back in 2019, pre pandemic, telling us telehealth would never be a thing.
Yeah.
Well, we're here now knowing that that definitely can be a thing. And then we were told like putting in quality components to care delivery is not going to be something that everybody's going to move to. And again, now we're seeing that with these mandatory models. So it was really about having this vision of ultimately in healthcare, we can all agree upon two things, which is we all want to do what's best for the patient
Mhm.
and we want to do it in a sustainable way. So we have to put those returns on investment, those dollars have to be there because a hospital that's not sustainable shuts down and creates a medical desert, right? So it's important that they create a sustainable path to care delivery. Ultimately, it always has to be measured in outcomes, right? We don't expect this from any other industry that we interact with, right? If you don't get what you paid for, you have a way to reconcile it, whether
Yeah.
it's the customer perspective or the ultimate payer. In healthcare, that's been so fragmented. And that's what's wonderful about this model. And I really, you know, praise CMS for taking these bold steps with the, Dr. Oz, Abe Sutton, really putting this forward because it says very simply, deliver better quality of care and then we'll pay you for it. And it's so simple. And that's, I think, when I closed my eyes in 2019. That's what I saw that we could get to because it was just an eventuality.
Right.
And so the question really was when, not if.
Yeah. And in that specifically, I think one kind of problem, a lot of founders have in the early stages is like, when pitching to a lot of these, health systems and providers or even payers at that front, it's hard to know what each, stakeholder wants. CFO, as you mentioned, you want to get this into the CFO and the CEO. And they might both are looking for maybe different things. How did you kind of figure out this is what the CFO wants, this is what the CEO wants, this is maybe what the CIO wants? Like, how did you kind of learn this is what they're looking for and maybe change your pitch according to that?
Yeah, that just requires becoming an expert on your champion and becoming an expert into the system you're talking to. So my pitch is never the same twice because I have to become an expert into the hospital or the system that I'm talking to. So every time, think about this. I am engaged with over 200 different hospitals.
Yeah.
Every time my pitch is different, not because we change, but because the system you're talking to is different. It's the same thing about us as people, right? Think of these as very complex organizations with their own cultures, their own needs, and their own challenges and priorities. So when I walk in, my is to make it as light of a lift on them. And that only happens if I can personalize it to them. And if it's
Mhm.
not a priority, it's not going to be a fit. Right. And different systems respond at different paces. So also figuring out who will be our early movers versus our late adopters is homework we need to do before we ever walk in the room.
Right. And kind of, I mean, you mentioned you guys are working with like 200 out of maybe like 600 health systems. What is the key driving force of one, keeping in touch with all of these? And that could be in hiring on your case, and also giving proper feedback loops to these organizations in a proper and coherent timing. Because ultimately it comes down to the patients and making sure everything is correct in their case, right? So, like, how do you guys maintain a proper feedback?
Yeah, so we have dedicated teams, right? Like not unlike Epic. There's always someone on our team that our customer can get a hold of. And so our product should be scalable is our philosophy,
Yeah.
but our customer service should be personalized. So this allows us to maintain that close relationship with every single customer that comes through. We dedicate it to their clinical workflows. We train their teams and we spend time with them and they always have a way to get in touch with somebody on our team. And most of our champions, the CFOs and CEOs actually end up signing the contracts, have a direct line to me, right?
Mm.
They actually have my personal number and they can call me anytime. And that's what we provide. And the product speaks for itself, right? So you can't have one or the other. You have to have both. So
Yeah.
our product stands by itself, but also we have that human relationship that allows us to evolve with our systems and customers, even as things change rapidly and in real time.
Yeah, interesting. And in like, for example, like when you kind of started, obviously the health sales cycles were very long. And you mentioned in the beginning, you're pretty much compressing it massively. How did you manage to compress these sales cycles over time for Rainfall? Because these sales cycles literally can kill startups sometimes. So like, how did you guys kind of make that such a big kind of thing for Rainfall?
So it was a lot of time spent with the systems, right? Again, now this is my mom, which is you have
Yeah.
two ears and one mouth, right? Listen twice as much as you talk. And so we needed to sit down with our customers. And until we actually listen to them, we cannot possibly solve their problems. So when we actually finally understood it, you'd think that we are a compliance software. We're working with care coordination components. We're working in the post-surgical space. So you'd think my buyers would be focused on population health, care coordination, quality, and compliance. And that's where we started. That's where we went and we talked to them. And we were realizing that we weren't solving their critical problem. They had 1,000 priorities and team was just one of them. And it wasn't until we figured out the dollar amounts that everybody was at risk for the dollar amounts that we could actually help them get. Then we realized that it was a CFO and CEO because it's a tactical decision. It's a strategic decision that's being made. And those were the profiles that ultimately are responsible for that. And once we realized that we were solving that problem, and not just as a customer, but really the biggest value add that we provide is, well, this is one of your top 5 priorities. I know that when I walk in the door, and it's their only priority that they never have to think about again once they work with Rainfall. That is our ultimate value proposition, is we help them everything end to end, whether it's calling the Medicare help desk. I kid you not, that's what some of our team spends time with. Or whether it's actually doing complex clinical workflow reimagining and engaging their post acute care network, it doesn't matter because our job is to ultimately, again, quality, patient satisfaction, outcome, and case cost management. And only that ultimately gets things through the finish line.
Yeah, and what are these kind of and you brought up a great point there where, I mean, having a significant value prop can make or break what you're saying. And you mentioned earlier, kind of like making your pitch different is such an important factor, And one thing that's very interesting, and I always wonder is like, what are those like diligent questions that these like CFOs and CEOs are asking you guys that you most founders are pretty much missing, like, or like not having enough material in. What are those kind of questions that could much maybe potentially get covered or can be maybe answered much more?
Yeah. So I think there's a pretty standard. We're actually working with the number one health system in the country. And that diligence piece list, let me tell you, is very long.
I bet.
And it took us years to get all those items overall. But it was all about thinking ahead, right? It's engaging the right systems, like I mentioned, at the right time, where those we can build and we can, because we have to, as startup founders, as entrepreneurs, we are sailing the boat as we're building it. And it's important for us to know how much resources to put down at the right stage at the right time. So when we have those really intensive diligence components, we have them already built out so that we can be, that shouldn't be the thing that really blocks us. So it comes down to operational frameworks, it comes down to expertise, it comes down to credibility and security compliance. And just being in healthcare, we can't take liberties with people's lives, right? That's ultimately what diligence is coming
Yeah.
down to. So if you can build a scalable system that also has those security and privacy components built in from day one, and your whole team is dedicated to operationalizing those checks and compliance components, it actually moves through fairly quickly and seamlessly. And our whole diligence piece with, again, number one health system in the country only took us, it took us less than 2.5 weeks for that
Wow.
entire piece. Yeah. Because when you're ready, it's they want to work with you too. So
Yeah.
you knowing that, I think is actually our superpower, is saying, how do I make your life? That's how I always walk in, as a support, as an educator, as a champion for our customers before they're ever our customers. Is I always want to lead and make their lives easier, because ultimately that's the
Absolutely, absolutely. And I like that's one of that biggest kind of things as like a founder doing that and saying, trust me, even though I have a huge team, you can come to me and you have my number. That's such a huge calling on that end. How did it work for Rainfall though? I'm very curious since the beginning for the business model wise. Like, did you have to make many iterations on how you guys are going to provide this ROI and how you guys are going to make money overall for the company? And then and now are you at, like, a more solidified kind of plan?
Yes, absolutely. It was definitely a learning a journey for us as we were building it. But in some ways, when things feel right, you
Mhm.
know it as well, right? That's that sort of founder intuition that kicks in. Because when we were landing on this revenue share risk based model, it just immediately made sense and it solidified in our minds. Because ultimately, what we were trying to do is, my mission, my mission in life, not even before Rainfall, was, how do I improve care, access to care, make it more accountable, and make it more patient centric? And that requires alignment of incentives
Right.
across the board. And if my business model lies outside of those incentives, inherently it won't all line up. So when we came up with the revenue revenue share and risk share model, it just immediately landed both with our customers and with our internal core mission. And so I think that was the pieces that kind of fell into place because it shows every single customer, even before they come in, that we believe so heavily that we'll invest in the company, in our customers before they ever pay us. And that's been made a little bit easier with our Series A financing because not only are we the first and only operational framework on the market for these mandatory models, we
Mhm.
are also the most well capitalized company tackling such a large opportunity as well.
Interesting. I kind of want to talk about now, like about Medicare and that whole kind of place in it right now. We're seeing a lot of like, commercial payers kind of coming in and as well as, more, I guess, more disease the patient is to going on Medicare, Medicaid. What are you kind of seeing in the patient population right now who are on, Medicare and, what is the process of them, I guess, getting better, not just for obviously working with the health system, but, like, them overall, and that can be in patient engagement or anything else.
Yeah. So we tie all the complex compliance requirements, whether that's fall prevention, whether that's, age friendly measures, whether it's accessibility, whatever the actual thing is, we have over 1,000 controls that we actually track, right? So
Yeah,
think, SOC 2 type 2, all those controls, we built our own from the ground up. But ultimately, they still fall into those 4 buckets for us ultimately. So when we're going and educating the operators, when we are about what this model means, when we're engaging the post-acute care network and telling them why they're so important to be leaning in and understanding these models, it's really about boiling it down to an understandable and actionable framework that makes things easy to track, to make it data-driven, and also right now with the AI components that we've built from the ground up, it actually makes it possible in real time. And that's actually, if this model had been introduced even a decade ago, it
yeah,
would not have been possible because there's too much data, there's too much fragmentation to piece it together. And us coming in and actually building these models from the ground up, building our own agentic workflows with the human in the loop, it allows us to engage before things get out of hand. And, one of the easiest things to think about is with our care coordinators, when they jump in, of the thousands of the thousands of surgeries that they're managing the episode for, at any given time, they might just have a few dozen they need to spend more time with. So that sort of, summarization of where your time and effort is really needed makes a big difference on the outcomes. Because if somebody's doing well, they're doing great, they want to go home. You want to send them home because that's what's best for them. If somebody needs additional care and support because, they had complications in a surgery, then they need that. How do you provide that in a scalable fashion to them? You can't do cookie cutter healthcare. It has to be personalized.
I
And that's
agree.
where, we really help facilitate that.
You brought up an interesting point there where you mentioned human in the loop. And I think with AI right now, we can clearly see a lot of health systems, these execs, very wary about AI. I mean, they've been working with vendors for the last maybe a couple months or a year or so now, and they're regretting a couple of decisions potentially with, pilots that never really went and got executed as much as the vendors said that they would be. What is your take talking to these health system execs when it comes to AI, and what is their confidence level with it?
What we're finding is actually every single health system that we've engaged with, and again, over 200, have AI in their strategic roadmap. What specifically they want to do with AI is still a question mark for about 80% of them. So think about that. Like they want the technology, they want to learn, they want to apply it, but they don't know where to start. And that's where, us coming in with a tangible solution that's going to pay for itself, it's going to align to their mission of care, better care delivery, and improve those outcomes, that now is a tangible piece that they can put into action. If you come in just with the problem set or an ambiguous offering, really you're putting the work back on the health system. So education is a big component, but it's also about how quickly can you turn it into something that's actionable as well.
Yeah, and has a lot of these, health systems shown, resistance when you guys say, "Oh, we can automate XYZ." without having as many people, or has it just been pure excitement, which would be amazing?
Yeah. So it does matter on which system, right? So the culture of every system is slightly different. And so we're mindful of when we go in, who we're talking to and what the comfort level is. But when you show, improvements ultimately and hard driven data that shows increased patient engagement, increased outcomes, satisfaction, that's hard to argue with for anybody, right? So ultimately it's about getting alignment in a scalable fashion. And again, the human in the loop component is important because that gives people peace of mind. What are the guardrails? What are your protections to their patients, right? It's the health system's patients that you're coming in and trying to help. So they feel rightly protective. And so our job as is to really put their minds at ease and show them, like very tangibly show them how we'll provide what we call escalation protocols, right? Which is as soon as it hits something that our AI can't do, how's it getting escalated to a person? And what is that person's credentials? When they can't do it, who does it get escalated to next? Like we have a protocol that goes all the way from an AI agent asking the patient for follow up and engagement, all the way to a registered nurse. And we can point every single step of the way to our customers how that lays out. And now that's that comfort that allows them to lean in and know that they've done everything because that's their responsibility to be that advocate for the patient. And bringing us in is a huge, exercise in trust.
Right. Inside your own organization, where has AI like moved KPIs, and where has it maybe potentially underdelivered, where you were like, okay, we tried this by automating this kind of thing, but it didn't really work out?
Absolutely. So over engineering with AI is a real problem, which is not everything is a product based solution, if you will, right? When you're dealing with education of clinicians, asking them to go talk to an AI generated video is not going to go over well. Being in actually the room with them, showing, hey, a clinician to clinician, right? Like we have folks from Stanford and UCSF who were practicing clinicians for over a decade. They come into the room and say, these are the workflows that I worked on. Here are the workflows that matter the most to me. This is where I wasted a lot of my time. And showing to our clinicians with empathy what matters to them. Right. So that's a tangible way that we're keeping human to human interactions and then with care coordination, that's one other element. Most people, we hear these sweeping announcements of how AI is going to put care coordinators out of their jobs.
Yeah.
We don't
Yeah.
believe that at all. Okay.
Mhm.
We think that we allow them to just narrow in on where they should be spending more time, right? Taking that human in the loop component is so important. So AI becomes a tool that you use. It's the same thing as a computer or the internet. It helps you do your job better. And it's not about replacing you. It's about putting you in positions as the person, as the expert to where you are most needed. And those are the pieces, that require additional foresight and mindful building and that we've seen. And there's all these amazing workflows that we have built our agentic workflows off of,
Mhm.
which are amazing and scalable and things that nobody wants to be doing, right? Like, no, we don't, patients who are doing great don't want to be on the phone for 30 minutes with people and answering questions, right? But the ones who do need support, do need that empathy, do need that human touch, that's where you can spend more time rather than trying to, move to that next component of care.
Absolutely. Kind of in the team workflow, you were talking about many of the workflows. Where would you kind of, I guess, automate more of in that specific workflow, and where do humans have to be more in the loop than where it is now?
Yeah. So there's this aspect of handing, with even if you're a very sophisticated health system technologically, handing within your organization can sometimes be challenging, but it's doable. Now, the team model is post surgical, 60% of the cost and the care delivery happens outside of your four walls. Managing care coordination, not just within your system, but now across multiple what I call episode components, right? Whether it's a different primary care provider, outpatient therapy, skilled nursing, hospice, whatever it is, you're dealing with so many other components of care. Now that becomes incredibly challenging. because how are you working across schedules, across geographies, getting everybody to both share and then receive data in a scalable and compliant way? That's so us putting together a product-based solution that makes those friction points more scalable, that's where it matters the most. Where the human needs to stay in the loop always is overseeing the data on a higher level, right? How are you actually able to take that analysis and those outputs and then turn them into action and strategy? How are you able to take the patient need on a specific case point and realize this is where, somebody might have had a human moment of, you know, just not getting up in time to make it to their appointment. And then
Yeah,
how do you adjust them and put them back on track, right? Those are the elements that humans need to stay closer to the ground on. And then just, automated outreach and standard touch points. Those are some things that we can, just help scale and humans still stay in the loop regardless of that.
absolutely. I mean, I know you're also on the other side of the table for most founders in venture, kind of at Pack Ventures as a vice president. When
Mhm.
you also hear pitches from healthcare founders, what are you looking at specifically, and what are those key questions that kind of separate the real ones from maybe potential founders that are just building AI wrappers just for the heck of it?
Yeah. So for Pack, I'm not an investor at Pack, but
Yeah.
I was an investor for a short period of time, and it was interesting to hear the when the pitches come through and how not every founder has done the same level of homework, right?
Okay.
And has not fallen in love with the same problem set. And also, there's sometimes this perception of is it may be a problem, but is it a priority, right? Because if it's a minor inconvenience, that's not something that people can put everything else on hold to work on. But if it is one of the top three, top five priorities, that's
Okay.
when you'll see engagement, right? We were also, for the first 4 years of the company's life, in the classic 18, 24-month sales cycles. And then overnight, down to 8 days, eight
Wow.
days to sign a contract, beginning to end. I've never talked to the system before, walked in the room, and then we had a signed contract for 5 years, 8 days later. And like it changes when you figure out you're now one of the top five
Okay.
priorities. How do you engage that? And then how do you deliver on it consistently? Because,
Yeah.
again, like I'm standing on the shoulders of other giants and stuff who come before me in healthcare. Judy Faulkner's epic empire still looks through every single contract herself, right? And it's
Yeah.
a little bit about staying close to the problem and falling in love with it and making sure that you're providing value, not just a product, right?
Absolutely, 100%. I couldn't agree more. I mean, you kind of going to the rural health because I think that rural and underserved health is very, very important. You guys are addressing that a lot. I mean, a lot of times, I mean, around like what, 50 to 60 million Americans are affected, are like in these rural and underserved areas. What is the actual gap between, the story that policymakers are saying about rural health and versus what rainfall is actually seeing? Like, what are the differences, potential similarities between that as well?
Yeah, absolutely. It's such a large problem, right? It's really undefined in many ways. So where in the last couple of years, especially, what we've realized is that almost narrowing the scope of the problem we're trying to solve is the best way to go about it in healthcare. Because otherwise you are boiling the ocean. Not only do you have infinite possible ways to deliver care at the patient level, you have 3,500 acute care hospitals in the country who all have their own challenges as well. And then you have policies that everybody's reacting to slightly differently as well. And the way we think about it now is how do we provide again, sustainable way to deliver that care and start off in a measurable and impactful spot within those underserved communities. And that's where Medicare has actually helped us define it. And we're already seeing that expand. Next year, we're going to be in additional mandatory models, including age friendly measures. So, working with geriatric populations and in a quality based fashion. And also, another announcement in the post surgical space is CJRX, which is about joint replacements expanded. It was a
Yeah.
bundled, bundled model back in 2016 that got announced. And now it's actually been made mandatory and it's going to apply to every single hospital in the country. But it's really down to only 5 DRG codes overall. There's hundreds and it's only down to 5. And that's how we are now thinking about rural is not an undefined problem anymore. It's about how do we start off with these patients, these hospitals, and then slowly help build essentially a repertoire that we can pull from as needed and provide best practices and share those across different systems while keeping their proprietary and secret sauce to them as well at the same
Yeah.
time. So it's a fine balance.
I bet. The same models that are unlocking revenue from big health systems are can actually also accelerate consolidation, I feel like. We kind of seen this a lot. How do you avoid being part of that big problem of consolidation, and how do you guys mostly like avoid it?
Yeah. Could you help me define what
Yeah.
what you're trying to get at from a consolidation standpoint?
Like, I feel like a lot of, health systems are mostly, have multiple vendors, and at one point, one or two will probably be horizontal at one specific point, maybe tackling your space or maybe tackling another whole remote patient monitoring space or something like that. How do you kind of avoid being, like, just a vertical solution, but just also kind of just working in the main horizontal layer for the hospital so that they can just focus on using Rainfall?
Yeah, absolutely. It's about being end to end in many ways. We are not, and also we're very fortunate in this way. We're actually a category creator. So we actually wrote the playbook in the category that we're playing in, which is how do you actually become the operating system on top of, your existing clinical workflows and your electronic health record? How do you actually operationalize those pieces? So for us, it's about staying ahead of the game. And that consolidation doesn't touch us because we are moving so much faster. We have this 2.5 year head start on everybody else who's looking at this, which just takes a lot of conviction and a lot of sleepless nights.
Yeah. Two more questions before a quick rapid fire here. I mean, you've kind of credited the Northwest Arkansas ecosystem heavily, like you died great Arkansas. What is the main differences you see in Arkansas that's very different from the Bay Area and Boston specifically?
Yeah, there's a book by Malcolm Gladwell called Revenge of the Tipping Point, and I'd recommend it. It talks about culture of different areas and how that affects not just something tangible, but it's an overarching framework. And there is this component of Arkansas where it's both small town in some ways where people want to help, right? There's everybody is more accessible in some ways. And so I think finding solutions doesn't have to be as complex. But at the same time, there's also a limiting of the types of problems that can be solved. There's a little bit more of accepting things that we should be pushing to improve. So I think there's that sort of cultural differences that happen versus, now our company is based in Silicon Valley and San Francisco Bay Area, even though we work across the country and have, dedicated teams in different geographies. The
Yeah.
challenges here are there's much more, people aren't as accessible. The leading with that personal person to person interaction isn't always top of mind,
Yeah.
but there's this ability and understanding of the crazier the mission, you'll find people just as wild willing to take this bet on with you. Because when I walked in to the, the room with Mike Gogan, who was at Sequoia for, over 20 years and now is the founding partner at Two Great Capital, and Dr. Mark Adams, and told them this vision that I had to really reinvent healthcare standards in the country that could be taken in many different ways. And, I'm just glad that they believed in the vision that I had to enough to give us the capital we needed to really bring this into reality for more systems that may be even more cash strapped than the ones that we're currently working with.
Yeah. Final question here, or I guess two more, I promise. What is the health system gap or healthcare gap between, Arkansas and a rural location like that and maybe the Bay Area where it's very populous? And is there any changes that need to be done specifically from that one location to the other? Or is it kind of getting better as we kind of speak?
No, so it's really two ends of the spectrum. So the challenges are completely different. In the San Francisco Bay Area, you have, so looking at it just from the lens of team, you have over 30 mandatory hospitals on just the team model. That's not every hospital. That's just on the team mandatory model.
Uh-huh.
Then you conversely put that in context of Arkansas as a state, not the San Francisco Bay Area, which is just a location, but Arkansas as a whole state has under 7 mandatory facilities.
Wow.
So you just are dealing with such a different scope of problem. Secondly, when you actually look into it, if you're one of the mandatory facilities, you have to manage this entire post-acute care network, right? So you have to pull together all these different disparate episode components to provide this care for that 30 days. It's so much
Yeah.
more challenging because you're dealing with a much smaller post-acute care network. And now you are also putting this challenge on the coordination on the patient because they might have to travel 1 to 3 hours to get that care. So when do you strategically drop in innovative technologies as a way to actually deliver cheaper but still higher quality care? That's the sort of personalized touch that I mentioned at the top of our conversation that we always have to do, which is the problem sets are different. And how do we understand the demographics of the patients, understand the challenges of the system to ultimately deliver this care?
Yeah. Final question before the rapid fire is what did, and you mentioned this, what did Two Bear see in Diligence, I guess, that other investors that you potentially were looking at didn't really see? And what is the I guess, the cap table sequencing lesson there, pretty much?
Yeah. So I think the first one is you have to, as a founder, always believe in your vision, even when you hear all the no's. I think that's just the classic story. Doesn't make it any easier, but I think just really holding on to that conviction does matter. When I met Dr. Mark Adams for the first time, who's now on our board, it was when we were going through Creative Destruction Labs back in 2020. And I actually showed up to our demo day. It's an accelerator in Seattle. And I showed up to our demo day. I was in front of all these executives in healthcare and all these investors. And I told them that I had just landed I had good news, bad news. The good news was I had landed multi-year contract with Indian Health Services providing care to Indigenous community members. The bad news was I wasn't sure I had enough money in our corporate bank account to fill the gas in my rental car before I returned it that day. We had $23 in our bank account. And we had people in the room just by show of hands wire in funds that day.
Wow.
And we raised $250,000 right there in the room. So it's partially, I think there's nothing besides you have to believe for everyone else. And then you find your people who see that vision ultimately. Because, in some ways, we have to both prove that we can stand for what we believe. And making some of those moves, as terrifying as it is, it also speaks to that right person you want in your corner. Because if you're trying to really, it's the old adage of people who believe they can change the world are the ones who actually do. But you have to have that big vision, and then you need to have that follow through to get the right people who also believe it in the same.
Very true. Very true. Now, finally, quick rapid fire here. Are you ready?
Let's go.
Yeah. So, what was the biggest takeaway from starting Rainfall? And if there's one thing that you could change from the beginning of starting, what would that be?
I think it was to really understand the industry landscape and its complexities and almost have a immediate action items tied to everything that we did right from the get-go.
Yeah. If you could change one thing that could be in policy or that can be potentially maybe something in the health system, kind of the way that they maybe scout vendors, what would that be?
It would be to build in standards right from the get-go because it helps the systems, it helps the data, it helps the payers, and ultimately us as the taxpayers also understand what we're paying for in healthcare in a normalized fashion.
Interesting. What was the biggest rejection you got at the beginning of maybe a customer interview that rejection became a yes over time?
The biggest one was I don't think this is a problem that we have. So this is
Yeah.
education to a system where you need to realize that they may not know all the pieces within the system. So you need to become the expert in them and then educate as a champion before they can become a customer.
Interesting. Yeah. Final two. What is the one book or article that you usually recommend to people to read?
Yeah, I would say the best one for me is Getting More by Diamond Stewart. And it's just a book about how to be genuine to yourself while also being good at selling.
Interesting. So now, I guess, what is the biggest advice that you've gotten from somebody that you didn't listen to?
That I should probably shut this thing down and it was never going to raise another dollar of capital. Yeah. We were not venture backable.
Yeah.
And and believe it or not, I've heard that hundreds of times and we're still here.
Yeah. And then final question, how do you balance family and work life? I know it's probably embedding into your family life, but how do you kind of sustain both of them?
The biggest one is clear definitions. Yeah, nothing sounds more heartwarming than clear definitions, but honestly, communication makes all the difference in the world. My girlfriend at the time, and who is now my wife, has gone through this whole life cycle of the company right here with me. And so
Right.
has my family, my siblings, my support network. It's really about letting people know you're like clearly how you are present when you are, and then the responsibilities and stuff you might have at work as well, and just making sure everybody's on the same step because ultimately your family, your friends want you to succeed. And, if you can help them understand what it is that you're building and how they can support, it does make a world of difference.
Absolutely. I agree. But dude, it's amazing to have you on the show and I enjoyed this so much. It was a pure joy. So thank you so much. I truly appreciate it.
Thanks so much for having me, Vic.